Welcome to Wright Veterinary Medical Center. This virtual tour will show you behind the scenes of our clinic. Because 2009 marked our 60th anniversary, I will add in some of our history from when Dr. Clifford Wright opened the practice. We have 11 veterinarians, 14 certified veterinary technicians, 14 nurse assistants, a groomer, 8 kennel attendants, 13 receptionists, and a managing staff. This is our reception area, where you may check in for an appointment or pick up prescriptions. The mural of animals on the walls was hand-painted to make it more welcoming by an area artist. A nurse shows you to one of our 8 exam rooms and begins the appointment by asking you for a brief history and obtaining your pet's vital signs. This allows the veterinarian to perform their more in-depth physical exam and ask specific questions about the health and wellness of your pet. The doctor or nurse may say they need to take your pet to the back, which really isn't as scary as it may sound. This is our treatment room and main area to clip nails, draw blood, and perform minor procedures and diagnostics. The ultrasound machine is a great diagnostic tool. It uses high-frequency sound waves and their echoes to view soft tissue and organs, as well as blood flow through the body. The ultrasound can also be used to perform biopsies of organs if needed. This is the pharmacy. Just like humans, dogs, cats, and other pets sometimes need more than their heartworm, flea, and tick products. Some medications on our shelves are the same as in human medications, but animals' bodies also have many differences and need to have their own medications to control pain, illness, heart, thyroid, and other conditions. We also now offer an online pharmacy and have information available on our main website. In here you may notice some of the original framing of a garage and barn that Dr. Clifford Wright did most of the early renovations himself. This was made into the entrance of what began as a one veterinarian practice. The pharmacy was the waiting area with one exam room. The ultrasound room, which you just saw, was originally the pharmacy and then a small surgery area. We have a 7 incoming line phone system that will always be answered by one of our front office staff during business hours to schedule appointments, answer questions, and handle emergency calls. Added to what was the front of the original barn outer wall, this is our phone room. And being separated from the front desk, it allows the receptionist to have their full attention on your call. Wright Veterinary Medical Center developed our own computer database, which holds all of our records, client and pet information, appointment schedules, and products, allowing an efficient way to bring up your pet's paperless file. This area, originally horse and cow stalls, was turned into a kennel, and now it is the nurse's station and also where we sterilize our surgical instruments. This is our dental suite. We have a dental technician who works alongside the veterinarians to provide full companion animal dental hygienic services, including cleaning, scaling, and extractions if needed. We also have further diagnostic capabilities with our digital dental radiography. The dental suite can accommodate 2 dental prophylaxes at one time. This is what we call surgery prep. This is used as another general examination and treatment area for veterinarians and nurses, but mainly for preparing pets for routine and other surgeries. Wright Veterinary Medical Center is American Animal Hospital Association accredited, which promotes the highest standard of veterinary care. Although AHA accreditation is not required of all animal hospitals, we strive to maintain this high standard of care, which requires going through a rigorous inspection every 3 years. The scrub sink is where the veterinarians perform their sanitizing surgical scrub and then gown for surgery. As you can probably tell, this area was built on later, because 60 years ago the daily income of the practice was only $9 a day. Dr. Clifford Wright built on and added new medical equipment as he could, always trying to stay up to date with the latest advances and growing need for small animal medicine when the farms and dairies began being replaced by housing and families. This area is our exotic surgery suite. Most of our exotic or avian surgeries are emergency situations such as broken legs or wings, egg-bound birds, or wounds. As a community service, we work in partnership with local wildlife rehabilitation facilities, treating their injured or sick wildlife when needed. These surgical units set up are laser and cautery. We have these options available for your pet's surgeries. The sterile surgical suite contains state-of-the-art veterinary monitoring equipment. Your pet is also monitored by a certified veterinary technician throughout the preparation, surgery, and recovery of your pet. In a normal week at Wright's, our veterinarians perform an average of 45 to 55 routine spays, neuters, dental cleanings, and non-routine surgeries. We also perform various emergency surgeries. This is our recovery and intensive care area. All of these cages can be heated, and this one provides oxygen support. We now have the technology and advantage of digital radiology. Dr. Clifford Wright did not have the benefit of radiology for at least the first 2 years of operation, but Dr. Ernie Siegfried, a human doctor in Nazareth, allowed him to bring the animals to his practice and took the x-rays without accepting payment. Before the era of digital technology, radiographs are processed much like photographs, and not only does the digital technology cut down on time for results, but it also offers benefits of diagnosis, including ease of emailing or sending them to a referring or consulting veterinarian. This is our medical hospitalization ward. Most patients in here are usually on IV fluid support. Our IV fluid pumps regulate the rate and amount of fluids the pet receives. Intravenous access allows nurses to administer antibiotics and other medications to ill pets. At this point, we move into our kennel. We board for our clients. We do have limited space and ask that you call as early as possible to make reservations. Because we are in an animal hospital, it is a great place to board your beloved pet while you are away. Your veterinarian is near if they were to have any complications while boarding. Dogs small to large board in these wards down here, and the cats board on the upper level. Jen Brown is our kennel manager and groomer. She has been grooming for 13 years and is highly recommended by any of her clients. Grooming is a very important part of your pet's well-being. Not only does she make them look and feel wonderful, but Jen has also found things that sometimes go unnoticed by the owner, such as ear or skin infections, wounds, fleas, and so on. If you would like her services, please call for more information and scheduling. The indoor runs are for large and giant breed dogs or multiple dog families boarding. We cannot permit visitors into our isolation, but is set up as a small medical ward, including another recovery cage, food, sink, and supplies to limit contamination throughout the hospital. The original chicken house, chicken yard, and apple trees had to be sacrificed to provide an area to walk hospitalized dogs, and our 8 separated outdoor runs. We also have a crematorium on site, which is another one of the services we offer. This portion of the hospital was added on in 1997 with more insulated sound-protecting walls to give our cats and smaller animals a barrier from the stress of barking dogs. Boarding cats are housed in this kitty condo. We also have some house cats that are here, and we use them as blood donors if needed. F ward is for surgical or hospitalized cats, as well as pocket pets such as rabbits, guinea pigs, and chinchillas. These 2 climate-controlled rooms are the exotic wards for birds and reptiles. They are kept at a tropical climate of 80 degrees, and that is why the doors remain closed throughout the day. One is for boarding these pets, and the other is for hospitalization, and includes 2 exotic ICU cages that regulate heat, humidity, and oxygenation. This is our in-house laboratory. We have 8 top-of-the-line blood and urine analysis machines. We have a certified veterinary technician whose job here at the hospital is running and maintaining the laboratory equipment, blood, and also sending out more specific tests. We try to do as much testing in-house as possible to allow the veterinarian and owner same-day results. Because your pet cannot tell us what is wrong, we rely on our diagnostic testing to confirm and begin treatment. Our conference room is used for meetings, informational lectures, or continued education for the staff and community. There are also groups of puppy classes which meet here weekly. Thank you for watching our virtual tour and listening to some of our 60-year-old history. It is because of Dr. Clifford Wright's love of all animals that this animal medical center continues to expand in size, staff, medicine, surgery, and now rehabilitation and alternative medicine to further serve you and your pets. Please also take advantage of the online tours available at the new Animal Therapy Center.